We have three speakers today, and I'm very pleased to present them. Joseph Guay, who's an independent consultant for World Vision International, who's just looking at between refugee and host communities in urban and non-camp settings in Lebanon and Jordan, a desk review. Dave Levin, for the Refugee Open, building and looking at is that a document for people? Called building a humanitarian Google X, reimagining humanitarian relief through disruptive technology and the democratization of production. And we've also got Sean Thomas from West Asia, North Africa, WANA Institute, looking at disrupting the institutional environment of refugee assistance. Some observations and recommendations from Jordan.
Sorry,
yes.
Can we tweet or not?
Sorry?
Can we tweet?
Yes, absolutely.
Okay.
You can, just not necessarily making attributions to the presenters. So if there are any comments or issues, perhaps you could also check in with the presenters themselves afterwards. Is that okay? I'm just going to read from a piece of paper because unfortunately we've just met today and we've just been given some of this information. So just to let you know, this panel will convene the presenters and projects based around the Syria crisis and response. The first presentation, which will actually be Dave Levin's, will share some case studies on improving human rights fulfillment of Syrian refugees and other victims of conflict in Jordan through the application of disruptive technology, such as 3D printing, robotics, brain-computer interface, and the Internet of Things. The second presentation will feature a discussion with Joseph Guay, an associate at the Policy Lab, to discuss the problem of social tensions between Syrian urban refugees and host communities in Lebanon and Jordan, which is a starting point for World Vision International's Social Cohesion project. It is also part of a longer-term evidence-based design research initiative with the aim of employing urban peace-building and developmental resilience frameworks to develop new innovative program approaches. The third presentation with Sean Thomas will investigate and analyze some key trends of refugee policy programming at the governmental and humanitarian levels, taking examples from Jordan as one of the principal host states for Syrian refugees, and to reflect upon the normative dimension of the learned and repeated behaviours within and among major refugee organizations. My name is Carla Lacerda, and I will be sort of timekeeping. It says here that I am working for the Cash Learning Partnership, but actually that was my previous employer. I am currently now with Save the Children, seconded to UNHCR, and I'm the Senior Cash Advisor for the interagency in Lebanon. I do think that some of the issues that the presenters are talking about is very, very topical, particularly in Lebanon. Some of the issues around social cohesion, which is really a deal breaker for any conversation with the government that we have right now. Whatever we do for the Syrian refugees, we need to be looking at, for example, what are we doing about host communities and sort of technologies as well and innovations, absolutely, particularly in urban settings. So I'll let the speakers kick off. We will have about 15 minutes for Q&A, and we're hoping to finish by 12:45 if we can.
Can you give me like a 5-minute warning?
Yeah.
Okay, great. So I'm Dave. I'm the founder and executive director of Refugee Open, Ware. It's a humanitarian innovation consortium that specializes in the use of advanced technology to improve human rights and basic needs fulfillment in conflict zones. Our partner is called 3D MENA Social Innovation. It's a Jordanian nonprofit. Very important to have a local partner. Basically, we are going to propose during this talk that we reimagine humanitarian relief in two ways. The first is by giving refugees and host communities access to advanced manufacturing tools, training, materials, and international networks of experts, particularly open source communities. Second, we have some very tough problems we need to solve. What we propose is creating a Google X for the humanitarian sector, a network of makerspaces in conflict-affected areas in which we crowdsource, co-create, and test solutions to the world's toughest humanitarian challenges. Now, in terms of context, let me just say that, so we have these massive challenges, everyone knows that. What I would really like to address to the humanitarian sector is that we have perhaps an even bigger opportunity. This is the dawn of the next industrial revolution, which is characterized by the democratization of production and the merging of the physical and the digital worlds. If the last century was about the democratization of consumption, the next century, this century, is about the democratization of production. Talk to McKinsey, the chief economist of General Electric, the economists, and they will tell you that, if you read carefully, they'll tell you that we are on the brink of the greatest economic transformation the world has ever seen. The question I'd like to propose is, can we bring together problem and opportunity, and more importantly, can we afford not to? Now, in terms of the mission, when I say advanced technology, let me explain that. We're talking about 3D and 4D printing. Has anyone ever heard of 4D printing? 4D printing is 3D printing of programmable materials that change over time, the fourth dimension, in response to specific external stimuli, be that temperature, heat, the sounds of Beethoven. Robotics and artificial intelligence, the Internet of Things, neurotech, specifically brain-computer interface, advanced materials, virtual and augmented reality and holographic computing, biotech, specifically synthetic biology, and the automation of 3D design. What's important is that a makerspace that we are creating, a digital fabrication lab, complemented by a set of conventional tools, allows you to create a prototype of almost anything, including prototypes of technologies across this whole spectrum that I just went through. This is our consortium. The founding partners are NextFab. NextFab is a large professional makerspace and hardware incubator in Philadelphia, founded by one of the leading pioneers of 3D printing in the world, Dr. Evan Malone. Ultimaker, which is the best consumer 3D printing company in the world, has given us 13 3D printers and lots of technical support. The Fab Foundation, which is basically the Center for Bits and Atoms at MIT, and 3D Mina, our local partner. Now, in terms of the other partners, it's a very wide array, from USAID to Zane Jordan to Fablab Barcelona, which is the best Fab Lab in the world, and they help set up makerspaces around the world. Oasis 500, which is the best tech incubator in the Middle East. And our board of trustees are some rather powerful folks in Jordan that are helping us move things forward. We're very lucky. The king loves 3D printing. He's actually donating $600,000 worth of industrial 3D printing equipment to one of the labs that we're building. We were able to present to His Majesty and Her Majesty twice, have the support of the chairman of the Joint Chief of Staff, several elements of the Royal Hashemite Court, etc. Trying to build a facility in which you can build almost anything within a refugee camp on the border with Syria does present a security issue, and so we are working very closely, as you can imagine, with all of the security apparatus. Now, three things we do. First, research and development, and I'm going to run through the different examples. Second is capacity building, so training both Syrians, other victims of conflict, and host communities on the use of advanced manufacturing technology. And lastly, infrastructure development. So we're setting up 3 labs. You want to set up a lab for Syrians, you probably want to set up a couple of labs for Jordanians as well. Now, the king, as I said, really loves 3D printing, and he also is very interested in this 3D printed prosthetics movement. So he wants us to help him set up a national prosthetics center within the Royal Rehabilitation Center in Amman. Second, the king also wants to have a makerspace in the King Hussein Business Park, which is a free zone in Amman. And that is really focused on job creation for Jordanian youth and venture creation in partnership with Oasis 500. And lastly, the main focus really for us is the world's first Fab Lab, a digital fabrication laboratory in a refugee camp, which would offer vocational training, educational programs for youth, business development, entrepreneurship opportunities, psychological treatment through interactive art. Okay. This is one example of the products that we are developing. I'm going to open up a video. I said I'm going to open up the video. I think it's already open. That's cool. Okay, here we go. Let me bring this back. You can see it. Okay, so this is a 3D printed prosthetic hand. This is a Yemeni boy, severely burned all over his body and lost his fingers, so he still has a wrist and he's able to control it by pushing down. This is one example of an early prototype. Now, it's important that there's basically three reasons why 3D printing is disrupting the entire prosthetics industry. First is that it's very high margin. Second is low volume, and third, it requires a high degree of customization. And so acceptance is a very big issue, particularly in the Middle East. We asked him, who's your superhero? And he smiled, he's a big Ben 10, is the cartoon. And so we made him a Ben 10 watch, Ben 10 hand, and we also said, what does a Ben 10 hand look like? He said, it has a watch, and the watch should have aliens on it. So we made it for him. We have a Jordanian designer at Fablab Barcelona who is able to create a really cool little game for him on this watch. And now, this is a prototype I'm going to send around to you. What's very interesting about this was the first 3D printed object that was created by Asim Hasna. Asim is a Syrian refugee. He was a paramedic in the war. He was saving lives, conducting surgeries in a converted vegetable storage facility underground in Syria. Drove an ambulance into battle. Of course, ambulances are targeted. A bomb hit the ambulance. He lost his leg. Now he wants to make prosthetics for other victims of conflict. He learned 3D printing in 2 weeks. Moreover, he learned how to hack the 3D printer to print this thermoplastic elastomer, which is very difficult to print. Nobody actually knows how to do that on the pepper printer that we have. It's not a direct drive printer, but he figured it out. So this is his first product. This is another hand that we made for a woman in Zapati that was able to use, she wanted to be able to care for her kids, and so she was able to use the hand immediately to take the core out of a zucchini, to make stuffed zucchini, and to braid her daughter's hair. We're going to move pretty quickly. Okay, so we're not just doing the prosthetics, but our friend Ahmad, who's a friend of Asim, at age 22, sniper hit him in the eye, went out the other eye, rendered him totally blind. Without really access to healthcare, he's in pretty dire shape. We decided we wanted to make something for him. We made an open source ultrasonic echolocation device with haptic feedback. Basically what that means is, I'm going to pass these around too. When you get close to something, it buzzes. Okay, so it's just shooting out sound waves and it comes back. It gives you a little buzz. So that's one version that we made. And another very important aspect of this one, yeah, it's going to be buzzing. You basically put it on your wrist. Now, what's very important about this one is that we had this idea, okay, because one of our director of R&D makes wall-avoiding robots, and so he uses the same technology to make this for Ahmad. And now we don't have to work on it anymore. We outsource it to one of the community members of Ultimaker, an open source community, and he's now iterating and improving upon it. So the point is that the humanitarian sector has resources. You just have to tap into them. Now let me show you a little bit of a video of him using it. This is the first prototype. There's many different iterations, and we are now making one that's very cool for him with kind of a steampunk design. And so like he says, he hasn't really felt like this in 2 years because he's able to walk with much greater confidence, basically. And we also bought him a stick that he prefers this. Moving quickly. How much time do we have?
We've got 3
Yeah, we have an academy called Freedom Academy in which we train anyone in Syria, anyone in Jordan rather, on 3D design. We're training the Royal Medical Services, so the exit strategy is for all this prosthetics work is to give it over to the Royal Medical Services to continue the research. And what's very interesting is here you see Asim actually training the Jordanian prosthetists. So again, learned 3D printing in 3 weeks, and now he's training Jordanian prosthetists. MIT is coming in the biomechatronics lab, which is the leading R&D facility for prosthetics in the world. Has gotten quite interested in this. So again, more resources that you can tap into. For psychological treatment through interactive art, just an example of that. So this is a slide on the makerspace in Amman. The designer who made the Ben 10 hand, Fablab Barcelona, they worked on a project.
So 42% always had enough money. Some people had.
What I did is create a robotic camera with 3 servo motors. It's able to rotate in any direction. The woman in the wheelchair has a virtual reality device. They choreograph her dance. The woman in the wheelchair can now experience what it's like to dance. Okay, cool. What's in a Fab Lab? Not just 3D printers. 3D printers are actually very limited, at least low-cost ones. So, CNC router, CNC milling machine, 3D scanners, digital embroidery, vinyl cutters, 3D design software, open source electronics. The combination of all this equipment allows you to create almost anything. And basically what this is about creating something on a 2D plane on your computer, fitting it to a robotic machine that makes it, that cuts it up in the right dimensions. In addition to that, of course, you need to have conventional tools. So a wood shop, a metal shop, a paint shop, textiles, etc. Here's another cool example. So awesome. People ask, what are we going to make in the lab? Well, frankly, we don't really know, but I'll give you some examples of things that we're thinking of. But the whole point is allow them to make what they need. Give them the tools, because they know what they need. So Austin comes to the lab, and he has prosthetic foot, right? And
because the poor have so little, we often see them.
Piece, he can't walk. This piece costs 25 JDs, about 35 bucks, 30 bucks. Has to be replaced every 6 months. So this is actually...
also say in some ways...
And instead of buying a new one when it starts to crack, he just 3D printed his own. It took him 2 hours. This one costs less than 1 JD, so it's a 95% cost reduction. All right, some challenges that we would like to explore. First, open source sheltering. So we believe that we can drastically reduce the cost of R&D and actually make more,
Receiving. And I think it's
within the lab. So this is a shelter would be primarily using a CNC router. This is called Wikihouse. It's open source housing, and we want to build on top of that. Furniture. So these kind of designs that you see here, there's some really nice designs. They're all free. You can just download them, put them into the CNC router, and make them. We're in touch with Open Source Vehicle, which is a group that wants to help us make an open source electric vehicle that we can create in the camp. Food production systems, recycled plastic bottles and car parts to make 3D printer filament, wheelchairs, etc. Now the point is that I come from a private sector background. So if someone came to me and said, look, we're bankrupt, give me more money, without telling me how they're going to reduce costs, and you'd probably tell them to get out of the room. So what our proposition is for the humanitarian system is first to look at the cost drivers. What are the biggest cost drivers? Well, the biggest cost drivers, according to a forthcoming OCHA paper, is logistics. 60 to 80% of the cost of humanitarian relief is logistics. $10 to $15 billion a year. What we're proposing is, what Field Ready is also proposing, is hyper-local manufacturing. So creating the products that you need on site. Then there's also some very crazy moonshot projects, more fitting for the Google X title. One is a mine detecting UAV. Another is, actually that's not even a technical challenge, but definitely a political challenge, is a drone that's been made at Stanford that can drop 1 kilo worth of critical medical supplies behind, say, the barriers of a siege. And so we're actually bringing that now to Jordan with the blessing of the king. Not into Syria, but into Jordan first. We'll see how that goes.
No-fly zone might be a problem.
As I said, it's not really a technical challenge. Auto-follow UAVs. So you can actually have a little watch and you have a drone on top of you, it follows you. You can actually create a swarm robotic system where rescue workers go to a scene and the drones are circulating on top of them and triangulating between them with infrared sensors to determine where are people trapped beneath rubble. In addition to that, we're thinking about ways to increase connectivity and create a smart refugee camp through the use of a low-cost Arduino-based system and a wireless mesh. I think I'm running out of time. I'll just say quickly, the first thing we did, of course, is a major social design effort. So we hired a Jordanian professor of conflict studies, and we went into the camp and we asked people, what do you need? Is this a good idea? Is this a stupid idea? 99% said yes, we want the lab. 89% they said they strongly agree. 84% said they're going to use the lab on a weekly basis. 54% said it's going to have an extremely high impact on their well-being. Another 30% said high impact. Why? Well, first of all, they want electricity. For the last, say, 6 months, there's not been really reliable electricity. Second, they want access to better tools. They want training on new tools. Very interestingly, they want to serve the community. So this isn't just a place where you go and you learn and then you leave and you can't use the tools. This is an open access community center, and it has co-working space in which refugees actually teach each other these skills. So you have informal knowledge exchange as well. And that's basically it. Something like this, you'll probably wonder, a Fablab you can build for $100,000. We're budgeting about $150,000 for the digital fabrication equipment, including customs and shipping, although RMX is now shipping it in free. Zane Jordan is sponsoring all the Wi-Fi for the lab. And probably another $50,000 for the equipment, the conventional tools, right? In addition to that, we actually have to build a building. So we have Humanitarian based in Athens who's developing a very beautiful space made of locally available materials, no concrete, easy to assemble, easy to disassemble, a very inspiring space with diffused light, and an art gallery, etc. So it's really in a courtyard kind of consistent with traditional Syrian architecture. And so it's not just going to be, it's really the ages that we can treat, we can deal with 8 to 80. Right? So now 75% of the women said that we can't use this lab unless you have a child daycare facility. So we will have a child daycare facility, and in that facility we can offer informal STEAM education. So that's kids building robots, as kids learning how to program Raspberry Pis, etc. Sure.
We've got one more minute.
Okay, good. Now, the last thing I want to say is that what I propose for the World Humanitarian Summit is to have all these tools actually on site in Istanbul. And you have basically a hackathon. And in this hackathon, you have different challenges, ideally sponsored with prizes by different actors. So you have a challenge on shelter, a challenge on food, a challenge on clothing, etc. And on the teams that are actually using these tools and are collaborating together are everyone from refugees in Turkey to humanitarians to scientists to some of the greatest innovators of all time, ideally with the World Economic Forum, if we can get that happening. People like Elon Musk, Carl Bass, Bill Gates, Mark Zuckerberg. Will they come? I don't know. But I bet some very interesting people will come. Other people like Jeremy Rifkin at Wharton, Gershenfeld, who created the whole Fablab concept, Nick Bostrom here at Oxford, Brian David Johnson, the chief futurist of Intel, is supporting us. Nicholas Negroponte is also supporting us, the founder of the MIT Media Lab. So I do think that you can get some pretty exciting folks there. And if you don't produce, life-changing products in 48 hours, at least we've opened the minds of the humanitarian sector to the possibilities of what this technology can do.
Thank you very much, Dave. Just to draw a couple of key points of what Dave has mentioned, on the democratization of production, I think that's really powerful. Reimagining the humanitarian sector, which is kind of what we're all here about, and really the issue around logistics and the cost reduction of that. I think that will really particularly bringing together problem and opportunity. I really liked how you put that together. So we actually have quite a bit of time, so I'm sorry, that's why I wasn't rushing you. We've got until 12:45, between 12:30 and 12:45.
Let's just,
We'll leave it
possible to 12:30.
to 12:30. Okay, great. All right. Okay, our next speaker is Joseph Guay, and he'll be, he's a social scientist, and he'll be looking at a case study and a desk review for World Vision International on social cohesion between refugee and host communities in urban and non-camp settings in Lebanon and Jordan.
Thank you. Okay, so first of all, Dave, that was incredible. It's going to be very difficult in general. So you raise a couple of, you've got my mind kind of going a little bit, so I'd be curious to hear what you think after looking at this project on social tensions and host communities, and if the tools that you're developing might be used as an input to alleviate some of those tensions. So there are a couple of specific areas that are going to pop up, so
Yeah,
I'm all ears. Yeah,
It's everything. Without solving that issue, you get nothing.
Yeah. Okay, so I'm an associate at the Policy Lab, and it's an international innovation lab for policy design for the humanitarian sector. And I'll be talking today about the problem of tensions between Syrian refugees and urban host communities in Lebanon and Jordan, but also why the investigation into the causes of those tensions is an important thing to do for humanitarian programming in these settings. So I'll talk about some key studies I've been looking into. We'll do a little bit of a gap analysis. How fun will that be? And then we'll talk about a path forward. So the one thing I want to mention before we start is that this is an innovation project in a way that it's about the process of this project. It's about applying empirical analysis over time to build effective programming. So it's in many ways it's a story of the social cohesion project as well. So I'll be telling you a little bit about the project in general and then some results from the project, and we'll sort of play around with that a little bit. So findings are derived from the work conducted through this project at World Vision. It's an action learning project. It's established through World Vision's Disaster Management 2020 initiative and through their urban and conflict strategic change programs. I'm kind of asserting that the idea of social cohesion is innovative methodologically, conceptually, and strategically. So I'd like to talk about that a little bit. So the context, of course, everyone knows, is the Syrian crisis, and sort of from a regional perspective that has generated massive protracted displacement. And so the focus of this is very much on the receiving countries, like Lebanon and Jordan, who host, Lebanon is host to about 1.2 million refugees, and Jordan is about 600,000, give or take. And so if you think about a country like Lebanon, who over the past 4 years has had a population growth of about 25% in just 4 years, this has massive implications on things like municipalities and their ability to deliver basic goods and services. It has created a housing crisis in urban settings, and it has created economic competition. So all of those things are coming together and actually recognized to have been generating tensions between these communities. In fact, if you look at just the 3RP and the Lebanon Crisis Response Plan or the Jordanian Plan, stability or instability is actually recognized within those documents, right? So about a third of those documents deal with stability and how to achieve it or how to maintain this fragile stability that we have thus far maintained. But you still have to ask the question, why social cohesion? So in some cases, the reduction of social cohesion or the rising of social tensions between communities have the possibility of generating secondary conflict in these spaces. So in Lebanon, reports are coming out that talk about things that are internal to one's perspective, tensions, animosity, hostility, and frustration, actually manifesting themselves into physical forms of violence. So in the form of scapegoating or harassment or discrimination, and also organized demonstrations and protests, curfews, and vandalism, right? So this is actually having real manifestations. The second reason why social cohesion or paying attention to rising tensions is important is because it directly impacts humanitarian aid or access and quality of aid. And so, for example, when you look at negative coping mechanisms of Syrian refugee families in Lebanon, rising tensions mean that self-isolation is unfortunately a strategy for these families. That means that there's a reduction in access to education when families decide not to send their children to school for fear of harassment or bullying or something like this, right? So it has a direct implication on education. If you want to provide education, you need to think about these things. Another example is that for young men in Lebanon and in Syria, Syrian men in Lebanon, discrimination could reduce employment opportunities, right? So economic competition is a reality. As tensions rise, we need to think about the ability to access work or to be discriminated against because you are a Syrian refugee. So again, livelihoods, direct impact there. So getting it right has the ability to enhance the effectiveness of humanitarian programming, and getting it wrong actually has the potential to do harm. Okay, so that's a assumption of this research. So naturally, the question then is to ask research questions on social cohesions. And so some of the research questions that we started looking at are, what are the factors that contribute to social cohesion or stability, or that have contributed to rising social tensions? What are the drivers? How do humanitarian relief efforts impact or influence social cohesion? And what are the current mechanisms or organizational approaches for addressing social cohesion? So this process through World Vision's change team study is innovative by nature. It's not an implementation and it's not an adaptation, at least what's coming out of the literature, because implementation, for example, takes known solutions to familiar problems, and even adaptation creates hybrid solutions to semi-familiar problems. But what we're seeing out of the literature is that this requires the design of new solutions to an unfamiliar problem in this particular context. So what we did to start out with the research questions is undertook a literature review. It's a semi-systematic literature review of reports and assessments from NGOs, think tanks, the UN, academic research facilities, knowledge platforms like ReliefWeb, community portals like AllNap, and we identified 625 sources and narrowed that down to about 100 through screening processes, through initial screening, collaborative decision-making with the team, and then reverse chaining to narrow these down.
And I'll talk about that. And then just relating ecosystem.
And there are 3 discourses that I've been taking a look at. And the first is urban, the urban problematic and the urban discourse. The second is development and resilience studies. And the third is peace building and conflict. So how are these discourses understanding social cohesion in the context of humanitarian response? Okay, and so that's sort of the first. So the urban problematic generally says that non-camp settings are challenging for humanitarian actors because they are highly monetized. Urban settings are highly monetized, and they're characterized by diversity, inequality, and interconnectedness. So sector-based approaches, the provision of aid, of food, wash, housing, education, and health, is deeply embedded in economic markets in those complex systems. So perhaps in an urban setting, if you don't understand that systemic nature of this challenge, social tensions between communities who are displaced and host communities has the potential to generate. Another approach looks at development and resilience discourse, and that uses resilience as a lens in emergency settings where communities can be sustained and grow over time. The challenge here in some of this literature suggests that how vulnerability is conceived in terms of sector, geographic, or categorical-based conceptualizations could contribute to social tensions. If you don't fully understand what vulnerability is and resilience frameworks, then maybe in a disaster humanitarian response in urban settings, there might be social tensions. And then finally, peace and conflict, of course, has been talking about this for a while. And you have realist perspectives that talk about power imbalances and weak governance institutions, misperceptions in the security dilemma, constructivist approaches that talk about the power of identity between in-groups and out-groups and the role of framing, and economic perspectives that talk about poverty, resource scarcity, and inequality leading to conflict. So why am I talking about this? I'm talking about it because if you put all of these, social cohesion sits right in between all of them. And if you put all of these perspectives together, what you actually get are the results that I'll go over in a little bit of the targeted literature review looking at social tensions in Lebanon and Jordan. They actually, if you take this theoretical model and the evidence that's coming out of it, it actually matches up. But if you take only a narrow view, it's a potential barrier to having an effective operation if you're looking at it only within one discourse. So the second step was, and it's larger than this. We looked at 15 studies, 15 key studies in the last 2 years that try to quantify and capture social cohesion and tensions in Lebanon and Jordan. So the organizations and research institutes that put these studies out are like Mercy Corps, REACH, CARE, Save the Children, Oxfam, International Alert, International Crisis Group. So this is some of the new stuff. It's not the academic research per se, but it's there. And so it's important because A, of the space that these organizations take up in the research space that they take up in this area, and B, it's also important because the results coming out of these studies are likely to be used by the organizations who are commissioning these studies, right? So that's why I decided to focus on these. So we broke them down. What are the goals and hypotheses of these studies? How do they define social cohesion? What's their actual problematic that they're trying to look at? What are the locations that they've done these studies in? What are the data collection tools and methodologies that they're using? Findings, recommendations, and gaps. Because the notion is how you go out and measure a problem or a phenomena in real life influences what you know about that problem and probably what you can do about that problem. So that's why we're focusing on the methodology here. So results suggest, so here are the results, and they match up with the conceptual model that I talked about before, that there are drivers of social tensions are structural vulnerabilities that predate the crisis, housing issues, access to basic goods, services in municipalities, education and access to education, health, and perceptions of international aid and the role of framing in the media, social media or otherwise. So this suggests a combination of those discourses. And what they recommend is take an area-based approach. Organizations should empower and work through local communities. So, sorry, I'll just go back. If you take an area-based approach, that means that the vulnerable community that you're targeting is both host community and refugee community. So no longer identifying refugee as beneficiaries only, but sort of widening that out a little bit. The second one is empower and work through local actors. So instead of providing aid directly, maybe that has a chance to create a parallel system there, and that's not what you want to do in an urban setting because we understand urban settings are complex and diverse. So work through local actors, empower them over the long time, and that's kind of a resilience thing. And the third thing is be sensitive to tensions, okay? But there are some gaps. I just want to go over just quickly the gaps, and then I'll close up with sort of ways to look forward. There are methodological gaps, and I don't know how many social scientists or data nerds are in here right now, but I'm going to go over some of them because they're important. So first, across many of these organizations, there's a sampling bias. And I don't mean the way that they sample individuals, I mean the way that they identify communities and geographic locations by which to do the research in. So on the one hand, most of the research, like for example, if you identify 200 communities and then say, we're going to focus our research over time on 20 of the most vulnerable communities or 20 of the most high tension communities, that is great for humanitarian targeting because it means you're helping those communities. But if you're trying to assert causality, it's actually not good, right? Because causality is determined by covariance, right? And the accounting for confounding factors. So if you don't select positive case studies, or if you don't select case studies somewhere in the middle, it can tell you nothing about the true drivers of social tensions. So that's the first thing, sampling bias. Second is an over-reliance on surveys and workshops. So most of these studies are mixed method, multi-level. That's great, but a significant portion of which talk about the micro level in terms of surveys, so it's a perception of perceptions, kind of, and workshops, high-level workshops. So identify key people and then do a workshop with them. And so I actually think, I'm of the notion that that's not enough to tell us about the processes by which tensions actually occur, especially if you have a sampling bias and other factors. The third challenge is a disconnect between structural factors and proximate factors. So just to give you an example, some great research was done in Jordan that surveyed communities, and they expressed that water scarcity was a factor that was kind of creating tension. So for example, those Syrian families over there don't know how to conserve water, they're using up all our water. Now, the footnote in that study said, we don't have information as to the actual water levels in this community. So these are the kind of things I mean between like the proximate drivers of what is conceived to have been happening, and it would be great to overlay those with analyses on actual things, actual electricity outages, actual water supplies, right? So there could be a call for that. And then finally, just quickly, lack of any sort of temporal variation. So these studies are all cross-sectional snapshots. Not one of them introduced time into their studies. One of them was, a good one was an intervention analysis, but didn't do a pre-test before the intervention. And none of them have temporal variation. Two conceptual gaps here, definitions of social cohesion. Only one study out of 15 defined social cohesion, defined tensions, and operationalized them according to academic discourse. Only one defined it. Other studies operationalized them right away and said these are the indicators that we'll look at, and some of them are pretty good. But then if you compare all of them, and especially if you're trying to standardize your data, things like this, they're actually looking at different things. So they're not, so there's no commonly agreed definition. And the second conceptual gap is a perpetuation of sector-based thinking. If social cohesion is truly cross-disciplinary, cross-sectoral approach is required, then that should be a theme of the report. But some reports recognize that in the beginning and they say, these are the drivers, education, according to education, wash, food, and things like this, and health. And then this is what we should do about it in terms of education, wash, food, and health. So it's kind of a perpetuation of the original problematic, which can be difficult. So those are some of the challenges I just wanted to talk about. Now the next stage of this approach is the innovation at the strategic level. So it's to take the results from the conceptual model, to take the results from the studies, and evaluate and assess what's actually out there in terms of strategic approaches. The 3RP, the national response plans of each country, and in the case of the World Vision Social Cohesion Project, World Vision's actual One Syria response strategy, to go through that and to say, are you accounting for this conceptually and methodologically, and is it part of your approach? So after this, I think that there are some recommendations to pull out. I should say that this is an ongoing study. It's not completed yet. We'll be publishing soon. But there are some clear recommendations. First, advocate the importance of social cohesion and humanitarian response. This requires more research on how social tensions impact the access and quality of aid. So I mentioned a couple stories to you in the beginning, the example of families not sending their children to school, so not because of isolation, and maybe discrimination, reducing livelihood opportunities. Let's do some research on that in the community, and let's advocate the importance of this through evidence and through empirical analysis. Number two, mainstream social cohesion. So bring social cohesion, or the understanding of social tensions, into your operations. If you are an NGO and you have a development department and a humanitarian emergency affairs department, mainstream that into both of those departments if they have to work together for this. That means maybe writing up a working document that says, so one example is making social cohesion work for World Vision according to World Vision's mission. How can we actually align this according to World Vision's strategy? And also maybe you can develop tools for social cohesion. So two ways of doing that: bring it into the capacity building. So if you're doing regional response simulated learning environments, this is stuff that I do trainings, bring that as a tool into the training. Another way is to talk about your data collection and rapid assessment tools. Make sure that you account for social cohesion. So that's the project in a nutshell. I hope was I about?
Perfect.
Okay, perfect. And there's a lot of stuff to unpack here, and so what I want to do in the question and answer session is to encourage you to ask me anything that you're unclear about, and to try to have an open discussion on how we might be able to use this research for actual operations in the field. I'd love to hear about it. So thank you.
Great. We'll have more time for Q&A just after one more presentation that we've got. But I just wanted to summarize a little bit. How social cohesion is measured. Great. Really, really interesting. Empirical evidence for innovation. It's really like building the basis of what we'd like to do. I think the drivers, recognizing that the drivers of social cohesion were always there to begin with sometimes, is also quite interesting.
Mm-hmm.
I think in Lebanon, looking at tools, UNDP is also looking at doing some social cohesion mapping.
Mm-hmm.
So they're actually again avoiding the issue, which is what are the drivers? They're just looking at where they're happening. and so highlighting it. But again, it would be great if agencies, if that could stimulate agencies to kind of go a little bit further into it and see what are the issues. I work with cash transfer programming, so a lot of these issues that we've been looking at is also how does providing cash transfers either create, increase, or actually diminish social cohesion issues. And there's quite a number of literature on cash transfer programming also and social cohesion supporting it. Some people will say it's actually quite positive.